people who will listen, the few will go and spread to the other people, and at the end of the day, we are creating general awareness for everybody in the community.
To protect themselves against teenage pregnancy or unwanted pregnancy.
We normally have live stream when you're having a radio talk show in Urban. We stream with Urban because Urban has a huge coverage of 21K followers. In our culture, like, we are not allowed to open up about sex to the young boys and girls in the community because they feel like it's a taboo.
2 years of impact, advancing sexual and reproductive health and rights with Jamnel Care to promote safe, responsive sexual and reproductive health and rights for women and girls in South Sudan. In 2023, Jamnel Care began a transformative 2-year journey to promote sexual and reproductive health and rights for women and girls in South Sudan, funded by Amplify Change. From Rajaf Tuliria and Moniki Payam, our vision was rooted in one bold belief: my body, my right. Gisem Tai, Hak Tai.
My name is Nelly Helen, Program Director, Jamnel Care Organization. Jamnel Care Organization is a young women-led organization that mainly comprises of youth, and we are trying to advocate for the rights of women, the rights of marginalized communities, and we are majorly operating in South Sudan, currently in Central Equatoria State. When you look at sexual reproductive health and rights in the context of South Sudan, being having a system of patriarchal beliefs, and we did an assessment and noticed that most communities in South Sudan, they don't have information on sexual reproductive health and rights. So this made us inspired to look for funds so that we can be able to meet the needs of communities in relation to sexual reproductive health and rights. We saw an opportunity. There was a call from Amplify Change, and it was a strengthening grant. So this was good, and because the organization was still young, we needed to be capacity built and also implement our activities. So when we approached the donor and submitted our proposal, they were interested in our proposal, and we were happy that they gave a go-ahead and funded our project.
But first, we listened. We began with a baseline survey, mapping the realities and challenges faced by communities side by side with government ministries and local leaders. We used these insights to shape interventions that were not just inclusive, but impactful.
In relation to the progress of activities, we had to start with the baseline survey so that we can be able to deliver the project in South Sudan specific context. So we did a baseline survey. We identified the areas. First of all, in Central Equatoria, there are around 8 locations that were identified to be highly vulnerable in relation to sexual reproductive health and rights and issues of rape and SGBV. So we did a baseline survey and identified 3 major locations where we were going to implement the project. That was in Rajaf, Liria, and Munuki. So we selected 2 rural areas and 1 peri-urban area. So after the identification, we were able to come up with the other activities as they were designed in the proposal. So we were supposed to do paralegal training for women and girls so that they can be able to understand their sexual reproductive health rights. Then also we were supposed to do training for the women and girls to understand what sexual reproductive health and rights is. After that, we were supposed also to create awareness, mass awareness to the general public, and we were also supposed to make publications that is media publications and articles on newspapers and even on social media pages like Facebook. We also engage different radio stations to air out our findings and more education on sexual reproductive health and rights. And we also had sessions of monitoring where we are supposed to identify the progress that the project is making. Then the final, that is the phase out state, we are supposed to identify the success stories, what the success that the project brought to the communities that we serve.
Somebody who have attended the validation for this workshop, and we have seen how the project was designed and finally ended with this exit meeting that have summarized the activities that Jamnel have been doing. We have seen how Jamnel have gone to the grassroots where before some partners have not reached. And we're really very much happy because when they brought to us their profile and they signed an MOU with us, and they consulted, and we told them, yes, your area of operation or intervention is in line with the policies of the State Ministry of Gender, Child and Social Welfare. When you see the policy is developed from the National Ministry, but the implementation part lies on the state. So Jamnel have not gone astray. They have really worked hard and their work is coordinated.
Through hundreds of sessions, we empowered communities with critical knowledge on consent, bodily autonomy, menstrual hygiene, early marriage, and gender-based violence. These weren't just trainings, they were turning points.
My name is Caroline Boy James. I'm 18 years. I'm from Muniki Block A, first year student at Juba. You know, most of us grew up in houses where parents don't talk to their daughters. You know, talking about your sexual health and all that, it's forbidden because of our traditional myths and all that. But with Jamnel Care Organization, I was able to know more about myself, and I'll be able to help some other young girls, the one growing in the community. I'll be able to teach them with the knowledge I got today.
I'm called Sarah, and I am 18 years old. I live in Gumbo Lafa. As a girl, I would like to advise all girls, they should take care of their bodies because nowadays there are a lot of diseases. Diseases like HIV. Let me say the sexual transmitted diseases. They are very common. So ladies, my fellow ladies, you have to take care of yourself.
This project has enabled Jamnel Care Organization to implement activities that were seen as a taboo. When we talk of sexual reproductive health and rights, in South Sudan, you don't just speak such issues openly. You have to find a strategy in which you will lay out and communicate effectively to beneficiaries. Since there is a challenge of stigmatization of survivors of rape or victims of rape, and also there is an issue of reporting such cases, domestic violence, in relation to the cultural context of South Sudan.
المهمة بتاع المنظمة ده منظمة صحية والكوميونتي بتاعنا في الهيلة في مونيتي بلوك سي بالذات انه هو كويس عشان بيقدر بيساعد الاطفال بتاعنا والشابات والشباب في اعمار بتاع المراهقة انه هم كيف يقدروا يعملوا حماية للصحة بتاعهم والصحة الجسمية والصحة اللي هو بيقول الصحة المباشر بعملية الجنس عشان نحمينا من كل الأمراض والمشاكل اللي بيحصل في العلاقات الجنسية.
3 طرق وري لنا الرئيسي يعني لازم تكون أبعد من حاجات زي ده، أو إنت كان في حلاقة تكون عندك يعني شريك الحياة بتاعك بيكون واحد، كانوا حبيب ولو راجلك بيكون واحد. وكان بقى حاجات دي كل ما بقدر كنترول، إنه بقدر يوز شنو؟ إنه بقدر يوز كوندوم. ده the last step. هاي يا في شهر بتاعنا ذات تريننج اللي في محل تريننج ده قال جسم تاعي أو حق تاعي. ده يا في الدراسة الأول.
نفس الصورة هم هيكون اكزامبل للمنظمة ده، عشان كيف إنه المنظمة ده يكون يمشي قدام، وهو بالتريننج اللي قدام ترون المنظمة ده إنه بيقدر بيساعدهم عشان هم يمشوا بنفس الخطوات اللي هم لقوا من المنظمة عشان يرشدوا اليوث في حلة وشابات في عمر المراهقة.
We developed a project design that we stuck to, and we always made sure that after conducting each activity, we had to go back to the project document to ensure that we were doing the right thing as per the project stipulated. Engaging with the communities, we ensured that we developed specific manuals, training manuals that were used in the capacity of the community to enable them to understand. And this is whereby we came with the slogan of "My body, my rights," and also use that slogan in Arabic. So it is much easier for the communities to accept the project from a basis of their own understanding.
Tabi beredo, tabi shilu always tabi geni bo 3 saat igairo, tabi dakal hammam, tabi shetib, tabi kerir libis always, misa kanja, tabi gairo, tabi dakal hammam, tabi gairo always. Yala bokora saba kanta gom tani tabokosh hammam.
فأثر معنا سديد لأنه أنا من ضمن الناس الجوزو اللي لسه عنده 18 سنة ولتي 25 ولا 20. فزوجنا في 18 سنة ده يعني أنا مستفيد ذاته عن شبابية. فأنا ذاته أنا لقوا إفكت جوزو بدري. يعني في جوزو بدري ده كان جوزيتا إتاجي إنه حياة بيجا براو من الكانتا رافو ده. ده بيجيبوا سنو بيجيبوا ليتا ذاته دبلو راجل. يعني جوزيتا والبراجل الأول له. إتا بيجان حياة ده غير وتا بيجا سيبو راجل ليتا برا لراجل تاني. ليانو موكتا كي بيجا فاتا. ياتا بيجا جارا لراجل تاني. إتا بيجا جانو الأول له بيجا كابترا لراجل تاني. فارسانا تاكان لبس ومهاتاي. جوزو بديري بنياتا كي كرامتا أسورو. وذاتو كان ما بدا جوزو متا أسورو غالي. rudu kalamta dozu bediri o makwis fa bi asir majena dozu bediri
fadata tangalet bitane ni taban kan big sag dimu ajat sambala sag bigul mara ya binedifu mara ya birakabo mara ya bamusuni an musharaka ma bikun beteriga resmi lakini aja ana fahimta minu aku minu mara zadi tendu rajal zadi indu hak besado indu hak zadi birakabo zar fenar asan kep haya bitakum shinu يمشي بطريقة الكويس.
الدرسو فعلا نينا واليوم لحد نمرة 3 يوم. أنا بدأ درسنا عن نسوان وان رجال. ففي كانت رجال قالي رجال بقى بنجوا ونسوان بركبوا. لكن في زمن تحسده ادي مرة بيجاتا جيش وراجل بيجاتا شبا asan kef anna bilimu ida anna baabeni shogol ma bodi le rajil wala shogol bodi le mara bara shogol na bishteri mahal wahid.
أنا جاني 3 يوم أنا شيلي من معلومة عشان كيف أنا بشارك في بيت براجل بتاعي. راجل تاكي كده تمو ديلو إيه حاجة يعني ديتو كان زي طبعا أنا ونسو في علاج تابنجوا كيف راجل بحارس وغنمايا كدينا في بلتين. لكن أنا بكيم قالي حاجة ده كله مع راجل ناس زي بكون هم بس مع الليلة لكن أنا ذاته في بيت بتاعي أنا بيجاني أنا ما بقول كلام ده في راستاي أنا براجل تاعي أنا بشارك أي حاجة كله سوا. راجل تاعي هو أصلا ذاته زول اللي هما بيشتغل لكن أنا ياو بساعده في كل حاجة. هو عسكري إنه من شهر 4 لحد يوم الليلة ما في نهاية لكن أنا هنا قاعدين ما في مشاكل ما في حاجة. أنا عندي لجلجة أنا بعمله في السوق أنا ببيع دقيق أنا ببيع جيال وإنا بيجيني مو.
This project has resulted to a lot of positive changes in the community. Number one, most women and girls, they are able to identify their rights. And also the women and girls, they are able to speak for themselves and say, no, this is not what is supposed to be done. This is as a result of the success stories that we've achieved through monitoring the progress of our activities. Number two, the project managed to create safe spaces for women and girls.
The change of this project, I can say that it has really opened up a pathway for most of the community people, especially the parents, the leaders, that they should take SGBV and SRHR very important. And also they have seen the interest and the impact of this training, because most of the adolescent girls and the women were able to learn their rights. So they have seen that advocating for women for their rights is something very, very important. And with this training, they were really excited because they have never had such trainings in their communities, and it was their first time to have such training. So it was really a great impact for them.
Collaboration fueled everything we did. We partnered with organizations like RIWA, AFRIAN, UNFPA, and engaged actively with the ministries of health and gender, joining technical working groups on sexual and reproductive health and rights, HIV and GBV. We supported national campaigns from International Rural Women's Day to 16 Days of Activism.
My name is Tande Elias. I work for Rise Initiative for Women's Rights Advocacy, that's Riwa, South Sudan. But as part of this project, we work in partnership with Jamnel Care. With collaboration, we have reached a bigger demography. We have reached a bigger number of people. We also have media platforms where we have been sharing also the information that we are teaching the local communities around. So it has captured a wider range of people, and I hope they have benefited from this training. And next time, we look forward to more collaborations and see how we can be able to build the communities together. Because one hand does not clap, it's two or three. We need the consortium stronger.
The collaboration is very much important because as a ministry, we do a lot of things. And the ministry as implementing agent of the national policies in relation to gender policies, we work with the partners who do conduct activities on gender-based violence, sexual reproductive health and rights, and also not leaving out the people with disability. And Jamnel is providing such kind of services. That's why Jamnel is very much important for us to complement what the gap is there for us.
Jamnel Care is a step ahead of where it was 2 years back. We've managed to join networks. We are in the HIV Network Technical Working Group, and also we have managed to engage stakeholders such as the Ministry of Health and the Ministry of Gender in our activities.
Playing right here on the Big Breakfast Club. We just only half past the hour 9 a.m. Central African time, and you're hooked into Urban FM.
We didn't just stay in the classrooms. Through powerful radio dramas, talk shows, media stories, we brought sexual and reproductive health rights conversations into homes, into hearts. Community members shared their stories live, their voices amplified, their truth heard.
The changes that we have witnessed when we go to the media stations for hostings, the callers, most of them say that they have learned something. They have known now that sexual reproductive health is a human right.
At Kuwait Hospital, we met mothers with care and information, hosting awareness events that brought sexual and reproductive health and rights education to the very doorstep of maternal health. As the journey continued, we went deeper, launching paralegal trainings, airing radio episodes, and holding vibrant community talk shows. We created safe spaces to learn, to speak, to lead.
This is the last training, which is a 2 days training on legal literacy awareness, which is something very, very fundamental, ensuring our communities are aware of their rights and they are aware that they need to know, because most of the times our communities always are locked into writings. They are not able to read or even learn themselves on our laws and their rights. But this is training that will enlighten them and ensure that they are perfectly understanding their rights and how they can conduct themselves in communities and ensure that they are living coexistingly positively.
We have attended very profitable training, which was conducted by Jamnel Care. We are really grateful for that. Actually, what is done in this training to create awareness to the community members, to understand the rights, to understand when there is a problem in the community, how they address them, and what kind of steps they should take before they take any actions. Example like rape. Let me just take a very good example like rape. When a girl is raped by a certain man, you have to advise that lady to go to police station to report there, so that the police station can start the procedures whereby this lady should be taken to hospital for medical attentions. Because sometimes when a lady gets raped, there's some certain diseases like SSTD or unwanted pregnancy. So when she goes there, doctors, of course, will be able to help her.
The Care Organization had started a process with the Ministry of Gender and raised a concern for zero tolerance for sexual, gender-based violence. And the process has gone and it is currently in Parliament for discussions, hoping that it will be validated soon. Jamnel intends to follow up with the process and ensure that such policies are validated and communities in the country are aware of the existence of such policies and people are taking action to ensure that they follow the policies.
So this training will help me a lot. I will go to my community, will conduct awareness based on the self-awareness. I will just also conduct awareness about the human rights, so that all the members of the community should know their rights. They should not allow somebody to come and violate them while they just keep quiet.
At least we were able to identify some organizations offering legal support, and some of our beneficiaries managed to get legal assistance. Since the project also entailed an element of monitoring violations and human rights in relation to sexual, gender-based violence.
And when the time came to reflect, we gathered leaders, youth, women, and men to celebrate a movement that had grown stronger, louder, and lasting.
I'm called Naomi Yar. I work for Jamnel Care Organization. I was the one heading the programs and also doing mobilization in the community, and also the trainee for the SRHR programs. So today was a very big day for us for this project. It was an exit meeting for this project because we're coming to the end of the project. So today we had the presentation for our exit meeting, going through the objectives and seeing all how we have been able to run through the 3 areas for all our programs, and also having our beneficiaries around us to see how far the program has gone and the achievements we have made together with the challenges. And it was really a very great program for us because I really learned a lot. I myself, together with working with the 3 communities, that is Muniki, Rajaf and Liria Payam, we really worked a lot. And so today, it was really a big day for us. We thank Amplify Change that next time they are giving us a project, we are able to deliver to the other states in South Sudan, because it's really on a high demand.
Jamnel Care
implemented these activities because these activities are really alarming in the state when it comes to gender-based violence. And gender-based violence, of course, we know is much prevalent here in the state and also South Sudan at large. And sexual reproductive health and rights also is another important activity that needs to be worked on here in Central Equatorial State. For instance, when you look at STIs, and also a healthy community requires awareness on sexual reproductive health and rights.
First training, actually, I attended it with my mother. She is one of the elders in the community, and she is really a woman who is open to discover new knowledges. And so she took me with her, and I came back and decided to teach the girls in the neighborhood who didn't get the time or the right resources to go and access the training. And about the changes, I'm sure with time we'll be able to see the changes. But I'm making impacts, I should say so. My message to Jamnel and the general, their partnership and their donors is this. I'm grateful for them. This was an interesting project. It's something that our community lacks a lot. There are a lot of projects that came to the community, but such, it's the first time and it is so beneficial. We need more of this so that more people will be included, especially the adolescent, and more people will get to learn a lot.
If Jamnel could be given another opportunity to work for 6 to 12 years in that area, we are sure that the gap will be narrowed down. That is so wide, and we have seen the prevalence of sexual gender-based violence. That needs a lot from the ministry and through the partners to work hard on that. And we really appreciate what Jamnel is doing.
Behind the scene stood a dedicated team, from coordination and communications to finance and monitoring. We were united by one purpose, one community, one belief. My body, my right, Gisimtai, Haktai.
Jamnel is youth-led, serving communities in South Sudan. We had to identify that specific category of staff. So we looked at the staff backgrounds, and most of the staff, they had some capacity in delivering sexual reproductive health and rights project. So we engaged the staff, then we trained them. We are glad that Amplify Change offered trainings in relation to staff capacity building that entailed project cycle management, finance management, then also monitoring and evaluation of projects. And also there were specific trainings and sessions that we had with Amplify Change that also capacity built our staff to be able to deliver the project.
We really dedicate ourselves for this project, especially working in those remote areas whereby people were blank, they didn't have knowledge on SRH and SGBV. So we trained them. After the training, they were able to know their rights and they were able to advocate for their rights. And I'm also proud that we didn't leave the people living with disabilities behind. Most of the people we met in the communities were living with disabilities, and also had advocate for them, include them in the training so they can know their rights and also promote their rights.
Thanks to Amplify Change and our partners, we laid the foundation for lasting sexual and reproductive health and rights in South Sudan. We are proud of what we have achieved, but this is just the beginning.
Our main achievement was to empower women through SRHR paralegal training. So that was our main achievement, to do trainings, and our target was 200. But we ended up having more than 200. So that shows how the project is on a high demand.
Through these activities that we have performed, I'm positive that the communities, they can be able to stand for themselves and for their rights, especially the girls and women. And also men who are engaged in the project, and they are able to act as champions to assist women and girls in achieving their sexual and reproductive health rights in South Sudan. So the other legacy is the weekly recorded programs. These are documents that never get old. They can be used as long as even 10 years after the project has ended to create mass awareness on sexual reproductive health and rights.
Community is aiming at Jamnel Care should continue with the training so that the life of those who have not reached the training should also benefit.
One of our legacies that we are really pushing is to advocate a wide range of people in South Sudan through SGBV and SRHR, and also we don't want to leave the communities behind. We want them to always advocate their rights, and also the people living with disabilities, because we feel they are part of the community. And we also want to expand as an organization to have at least safe spaces in every community that emphasizes trainings for the women and girls through the paralegal trainings.
I would like to take this opportunity to thank the State Ministry of Health South Sudan, the Ministry of Health South Sudan, the State Ministry of Gender, Child and Social Welfare South Sudan, and also the Ministry of Gender South Sudan for enabling us achieve the objectives and goals of the project. I would also like to take this opportunity to thank Amplify Change for making our dreams come true and taking a step and helping us take a step towards achieving the goals of Jamnel Care Organization. To other donors, Jamnel Care is available, and we are also seeking for more funding so that we can be able to advance our activities from sexual reproductive health and rights to other activities such as gender-based violence, education to women and girls, and also promoting the overall rights of women and girls in South Sudan.
Jamnel Care will keep moving forward, amplifying voices, shifting mindsets, and advocating for a future where every woman and girl knows her body, her right.
Gisimtai, haktai.
My body is my right.
Simtai, haktai.
My body, my right.